Huge thank you to CIBC for making We Get It possible. Hi, welcome to a new episode of We Get It. My name is Karine Chalifour. I'm the program director with Young Adult Cancer Canada. Thank you for joining us for this new episode. This season, we've actually changed things up a little bit, as you will notice. We will bring you every week, every Monday night, 7 p.m., we will bring you sessions that we have recorded and edited from our past events, sessions that are with amazing health professionals and friends across the country, some stories from Yackers as well. And we will talk about issues that are, we know, real things and real issues for the young adults we work with, and for topics like fear of cancer recurrence, body image, movement and exercise, mindfulness, legacy, palliative care. We are going to touch on a bunch of content. So we hope that those sessions are going to provide you with information and tools to help you live life and love life, and hope you get to join us every week and share with anyone who could be interested. So let's start now with this next episode of We Get It. Enjoy.
So first and foremost, folks, welcome everyone. For those of you who may not have met me personally, my name is Alex Mandarino. I am a 27-year-old Caucasian male. I am wearing a dark gray t-shirt. I'm in a living room here, the Hotel of Primetown, with some lovely windows to my left-hand side. I have curly brown hair and dark sort of square frame glasses. Super happy to be with you. The session today will be on brain fog. So title specifically cancer-related brain fog. To give kind of a description of what we'll be discussing today, it'll be the basics of cancer-related brain fog. So what we know, what we don't know, how cognitive rehabilitation can certainly help in this regard. So speakers today, which I will introduce shortly, they'll be presenting on the maximum capacity brain fog program offered by Cancer Care Manitoba. I will certainly take the time to introduce our incredible speakers today. So we have a few today. So we have Elizabeth Payne. Elizabeth is a fair-skinned older woman with short blonde hair and glasses. And Ariel Godbout is fair-skinned young woman with long brown hair and glasses. Just to kind of give a bit of a bio, and then I'll let them sort of take over from there. Elizabeth is the supportive care coordinator, psychosocial oncology at Cancer Care Manitoba. So she teaches the maximum capacity brain fog program at Cancer Care Manitoba. And Ariel Godbout is the psychosocial oncology clinician at Cancer Care Manitoba. She's trained as a facilitator of the maximum capacity brain fog program. And as I mentioned, these two are great just to talk to prior. I'm really looking forward to this session. But with that said, unless there's anything else, I will certainly pass the mic over to them too.
I'm Elizabeth, and really happy to be here. Ariel and I work in psychosocial oncology at Cancer Care Manitoba. So we're very happy to be sort of partnering with YAC for this conference. It's great. So Ariel and I are both counselors at Cancer Care Manitoba, and all of our counselors also do some support groups and programming. So that's the nature of our affiliation with brain fog. We have experience working with individuals like yourselves who may be experiencing cognitive or thinking difficulties that they associate with their cancer experience. But we've also been offering this brain fog program at Cancer Care for, I think, about 10 years so far. And so an overview of what we're going to talk about today is basically talking about what brain fog is, what kind of the symptoms are, what people often experience that they associate with having brain fog. We're going to talk a bit about what we know about cancer-related brain fog. And unfortunately, the other list that we'll talk about is what we don't know about cancer-related brain fog. And then we're going to talk about what can we do about it. So the approach that's used in the brain fog program that Cancer Care and some other centers across Canada offer was developed by a woman by the name of Heather Palmer. She's a neuropsychologist who is in Ontario. And she's developed this program. And Heather worked with people who had experienced different types of brain injury, like strokes, like blunt force brain injury, people whose brain structure had been changed in some way. And she was working on cognitive or thinking rehabilitation, and then came to the conclusion that people who have been sort of complaining of thinking difficulties after being diagnosed with cancer or treated for cancer, that these same kinds of approaches that are based on neuroplasticity or maximizing how we can adapt to things because of neuroplasticity, she took the learning she had from the other part of her neuropsychology practice and created this program for folks who are experiencing cancer-related brain fog. So a lot of the slides we're going to use are actually from that program that we're just using for teaching purposes today. But I want to say right up front that if you don't live near a center, you can't access the brain fog program that we're going to talk about. The same kinds of materials are available at other websites, and later on at the end of the program, we're going to be referring you to those. So the content of the brain fog program that we teach is very much mirrored in the kind of material that we'll be referring you to that you can look at. The brain fog program that we teach just does it in an in-person or a virtual way in a group of about 10 people. In the past, lots of folks have referred to brain fog as chemo fog or chemo brain. So I can tell you that about 15 years ago, I was working with Cancer Care Manitoba, but in a resource specifically for people who've been diagnosed with breast cancer. And we had women that were complaining of thinking like cognitive related side effects. And the term that was most commonly used was chemo brain. And by the way, 15 years ago, if somebody talked about chemo brain or brain fog, it was like considered to be a non-existent thing. It was not regarded as anything that was actually real. Okay. So, but we now call it cancer-related brain fog because although research is in its infancy about this, we know that chemotherapy isn't the only potential cause of brain fog, and that people who experience brain fog can, experience it due to a variety of conditions, not just cancer. It's really, when we talk about brain fog, we're talking about a bouquet or a constellation of symptoms that come about as a result of some kind of experience or circumstance. And today we're talking about that constellation as it happens for people who've been affected by cancer. Next one, please. So what are some of the most common brain fog symptoms that people find interfering with their life? And by the way, all of these symptoms are things that happen to anybody some of the time. But when people are feeling like they need help for brain fog, these kinds of symptoms or circumstances are increasing in frequency so that it kind of is really affecting their day-to-day function, and consequently their sense of confidence and sort of comfort. So a big one that people talk about is difficulties with memory, and primarily short-term memory. So long-term memories about, what happened when you were 6 or whatever, if you can remember when you were 6, those things would remain intact. But maybe what you did earlier today or something you're supposed to do later today, those are the kinds of things that typically are a problem for people who are identifying themselves as suffering from brain fog. Verbal skills. So verbal skills, when we refer to that, we mean verbal skills when people, it's language really. So speaking or reading or even interpreting. So very common for people who are experiencing brain fog to have difficulty with word finding. You know, you want to say, please pass me the salt, but instead you're coming out with something like, please pass me, you know, that stuff, the little white stuff that's in the little glass thing that makes your food taste different. You know, you just can't get the word that you want to come out of your mouth at the right time. So it's producing language sometimes is problematic. Sometimes reading is problematic. You just hit a word that you know you should know what it is, but you just have to skip over it because you don't really know. Another aspect of verbal skills is actually the receptive part of it. So listening to a conversation, particularly if there's lots of information or lots of stimuli, and being unable to kind of take in and compute what's being said. And that's very much related to attention and concentration. So folks who are being impacted by brain fog often have difficulty staying on task, right? So focusing on what they're doing and following through, or being able to concentrate when they're listening to somebody like me who's a talking head, or even if they're reading a book or watching TV or a movie. It's just that maintaining their focus on whatever it is they're trying to focus on can be very difficult. Um, Executive functions. So executive functions is stuff that happens in your frontal lobe. It's kind of higher kind of thinking things like calculations, you know, figuring out a tip, for instance. Strategic processing, like making a plan that's kind of complex or breaking down a task or a project into smaller parts. So it involves like using lots of your brain to do something or produce something. So organizational tasks, multitasking, those kinds of things would be executive functions. Very often those things are impacted. Some people also has difficulties with motor function and also coordination or feeling their body in space. So examples of that would be, you know, going to put a cup on a table and just missing the edge of the table, so that, you know, putting the cup on the edge of the table so it falls off. A lot of folks after they've had chemotherapy have, peripheral neuropathy. So I'm not talking about that kind of thing. It's the actual coordination of their body, or the placing of their body in space. Going through doorways and sort of losing track of how wide your shoulders are and bashing your shoulder into the side of the doorway. And then another huge aspect of brain fog is impact on your mood and psychological well-being. So it's kind of like a chicken and egg kind of thing, and we'll talk a little bit more about this later. But the most obvious aspect of it is that when your thinking is interfered with, your mood is interfered with, right? If if your capacity to think clearly is impacted and goes down, your mood and your sense of psychological well-being will come down, because generally speaking, most people's sense of self-confidence and comfort in a variety of situations is really impacted. And as I said, we will go into that a little bit more later on. Next slide, please. So what causes these changes? So I have to emphasize that the research into cancer-related brain fog is in its infancy. As I said, I told you that 15 years ago, when I was working in this center, where it was the first time I was working closely with people who'd been affected by cancer, and it wasn't uncommon they were women primarily, to be talking about how they weren't thinking clearly, and that had really changed. And a huge aspect of that experience was that nobody really believed them, and there wasn't really, nobody knew anything about it, and essentially just said, no, you're just you're just anxious. You'll get over it. It's not a real thing. So over the last 15 to 20 years, though, some research, and 15 to 20 years in the research world is a pretty short period of time. There has started to be some research into what the causes of these changes that are associated with brain fog might be. So it used to be called chemo brain. Well, we know that there's lots of people who have been affected by cancer who have never had chemo, who feel that they have symptoms of brain fog. So it's not just people who've had chemotherapy who have complaints that would be consistent with brain fog. There has been some research done. Most of the research done to associate chemotherapy with brain fog has been done with people who have received treatment for breast cancer. And really, it's been animal studies. Sorry, it wasn't people who've been treated for breast cancer. It's been the drugs that are used to treat people with breast cancer, but it was on animal studies, rats, in fact. And they did associate a certain drug that was given in very high doses as being associated with an increased risk for thinking disturbance. But it's not compelling evidence, right? And in a very, very narrow cohort of people. So is chemotherapy the cause? Maybe, but there's not compelling evidence for that. And so far the research is very, very narrow. So is it the cancer cells itself? Is there something about having cancer cells in your body that somehow affects your thinking? So there has been some work done in that, and it's got to do with the autoimmune response to cancer cells in your body and how that can actually affect your brain chemistry. There are a substance, a type of enzyme secreted by all of our cells in our body called cytokines, and cancer cells secrete pro-inflammatory cytokines, a type of substance that increases the inflammatory response in your body. So there has been some research done that suggests that increased inflammatory response affects your brain in such a way that it can cause thinking difficulties. Once again, it's the evidence is still small. There's not loads of evidence in that regard. There's been some some studies that have questioned if there's a link between genetics and a heightened risk of developing brain fog after you've been treated or if you've been diagnosed with cancer. Inconclusive. And in fact, the genetic link for difficulties with dementia, like Alzheimer's disease, so few people who are affected, who end up getting dementia, have a genetic predisposition. So that makes you know that the numbers for cancer, people who've been affected by cancer, would be even smaller. So those are the ideas that have started to have been looked into, the idea of chemotherapy, the idea that cancer cells themselves will secrete something that will cause your brain to work differently, the idea that there may be a genetic predisposition. There's also the idea that cancer-related treatments can affect the way you think. And for sure, that's true. I mean, those of you who have had who have had to use pain medication, nausea medication, who've been on steroids over treatment, you know that those kinds of drugs change the way you think, right? So that would provide some credence for the idea that cancer-related treatments can cause brain fog while those substances are in your system. And then there's the notion that psychosocial constructs, it's a very difficult term, but essentially we know that folks who are diagnosed and treated for cancer are under a lot of stress, right? A lot of stress associated with their diagnosis, with their treatment, and perhaps with things that are changing in their lives because they have cancer, not working, those kinds of things. So do those things have an impact on the way we think? And for sure, that's the case. But the bottom line is that our knowledge about what causes brain fog is very limited. Next slide, please. It's really, the research is in its infancy. There's a number of different there's a number of different ideas and areas in which there's being some work done, but there's not really a critical mass of evidence for any specific cause. The other problem is that who's responsible for diagnosing and addressing brain fog symptoms? Like, who would that be? Is it the oncologist who delivers a type of treatment? Is it your family doctor? Do you have to get a psychologist? So that's a limitation as well, right? It's not really clear who does what and who takes responsibility for what, because the causes are not really clear. The other thing is there's not really a lot of good measures around to be able to tell somebody, oh, yeah, you've got grade 1 brain fog, or you've got, mild brain fog or moderate brain fog. Because there are so many ways that brain fog can impact there's so many aspects of brain fog, calculation, language skills, motor skills, spatial skills, all these things. It's very difficult to measure these things. So there's lots of limitations in terms of how we perceive the causes of brain fog. There's lots of limitations in terms of how we assess it. But the reality is that people are experiencing it. And in a way, when people say, oh, it's all in your head. Well, a lot of people feel that that's kind of a dismissive thing to say, as in it's your imagination, or you're stressed out. It's not a real thing. But there are studies that demonstrate that it is actually all in your head, because what happens is that your brain works differently. It has to work differently in order to compensate for the fact that you're having these experiences. We know that people report that, and a meta-analysis is when they collect all the studies that have been done on a certain topic, and they assess all the studies, and they pick the studies that are credible, the ones where the scientific rigor is good and where you can have a healthy trust that the results are good. So there has been a meta-analysis done of all the research on brain fog. And this is what we know. Some of it's helpful and some of it is not helpful at all. So of the credible studies that have been done, we know that between 0 to 80% of people feel that they've had some some symptoms of brain fog. Not that helpful, right? We don't have a hard and fast data to say, yep, this percentage of people will experience brain fog. We know that symptoms can appear at any time. In fact, they can appear during or following treatment. There are also instances where people have noted that they were experiencing symptoms of brain fog even before their cancer was diagnosed, which has led some people to wonder about that business, about the cancer cells themselves causing some of the brain fog symptoms. Symptoms last for variable periods of time. So different studies report different time frames, but sort of the average is that people who experience cancer-related brain fog can experience it for 2 up to 5 years. For most people feel that they've kind of returned to their baseline, or they've adapted back to their baseline within about 2 years. But some people will experience this up to 5 years out. In general, if somebody is still experiencing it 5 years out, it's kind of at that point a question. Further assessment needs to be done to decide whether or not this is brain fog, or it may actually be something else going on. Now, the good news is that when people have brain fog symptoms, unlike people who have these kinds of symptoms, if they're aging, for instance, most people who have brain fog, they will get better. These symptoms will diminish over time. So that's the good news. The bad news is that 2 years can feel sound and feel like a long time to be struggling with these kinds of symptoms. So most of you, if there are folks out there who are suffering with brain fog symptoms, you are already adapting to this. You know, people kind of adapt to it naturally. They figure out their own ways. You might be writing more lists. You might be using your phone more frequently to give you reminders. You might be getting other people to help you remember to do things. You might be adapting when you plan to do stuff based on what time of the day you're the most alert. So most people are already tapping into their own ways of adapting to brain fog problems, brain fog related problems. Anytime, any of the approaches that we might take on to assist with cognitive rehabilitation related to brain fog, the whole point of it is just to speed up that adaptation. So we know that people tend to get better over the course of 2 years, whether you take a brain fog course or read a pamphlet or whatever. Most people tend to get better, but 2 years is a long time. So utilizing some strategies to speed up that rehabilitation is what most brain fog programs and websites and reading is designed to do, designed to help you with. So we know that for folks, brain fog is you know, regardless of that 0 to 80%. Next slide, please, Ariel. We know that it's one of the top 3 things that are identified by cancer patients worldwide. Another one of the top ones is fatigue, but and there are reasons why brain fog and fatigue are related. We know that the symptoms are quite variable, and we know that how much it impacts for people is very variable, and the condition is variable. We know that there are not regularly set up assessments for people with cancer to assess the impact of on their thinking of their diagnosis or their treatment. And we know that having brain fog symptoms has a huge impact on your life and the quality of your life. And we also know that there's evidence that your brain will make changes in order to adapt to the cognitive impact of brain fog. What I'd like to do, Ariel, if you don't mind, is I'd like you to skip one slide and go to the neuroplasticity slide. So just pass that one. So how do we adapt to brain fog, and how are we doing that naturally? Well, when something happens in our brain that impacts on how we think, our brain will naturally try to figure out how to fix that, how to go back to managing the thinking process in a way that's more efficient. And that's what neuroplasticity is. And you've probably heard of that term. So neuroplasticity is the brain's ability to reorganize its functions so that it can compensate for something that's not working right. So neuroplasticity, I don't know if something's changed, but the image went away. So neuroplasticity works in a few ways. If you think of your brain as having a whole lot of roads or highways in it that transport information around in your brain to allow you to do different types of thinking tasks, one way to repair those, one way to make it so that that information can still be transferred around in your brain is to repair the highways or the roads that were in it. There's an image of a road with a whole bunch of potholes. So when you have a road with potholes, somebody goes along to fix it by filling in those potholes and smoothing the road again. Another way that we can repair the transportation of information around in our brain is to build entirely new pathways, right? So if information is being transferred from one region to another in order for us to think or calculate or retrieve a memory, if the pathway has been completely wiped out, our brain is capable of making an entirely new pathway. So the image here is of an overpass, right? It's of a bridge being built over some other roads. And then another way that we can rehabilitate the way our information is transmitted in our brain is to be really, really aware and prepare for how we're going to go about a task. And the image here is of like an incredible traffic jam. So we might want to avoid a circumstance that feels like a traffic jam. We might want to really take care of how we are going to manage our thinking or how we're going to manage our cognition. I'd like to go back now, Ariel, to the fMRI twin study. This is going to be a tricky bit of slides to explain or describe. So I'm going to really, really boil it down, the image down, after I've kind of talked about it. The first thing I want to say is that the images that I'm going to talk about that you're seeing on the screen, the images that are lit up are not areas of the brain that have been damaged. Okay, they're not areas of the brain that are damaged by brain fog or cancer-related brain fog. What these images are is composite images of something called functional MRIs. So that's a test that many of you will have heard of what an MRI is. It's a picture of a part of your body that's taken, or it's a very detailed picture of a part of your body that produces an image like an X-ray or a CT scan, but in more detail. But a functional MRI actually takes a picture of the blood flow in the part of in the whatever part of the body we're talking about. And these pictures that you have up here are pictures of brains, and the areas that are lit up is where the blood flow is really concentrated. The greatest amount of blood flow is what's being lit up here. So years ago, there was a study, I think it was in the 2007. So this is called the twin study. So in this study, what the point was is that they wanted to see, were the brains of people who were complaining of brain fog, were those brains looking and functioning differently than the brains of people who had not been diagnosed or treated for cancer, right? So what they did was they did a study where they recruited, and the patients for this study, the participants were women who'd had had breast cancer. And so what they recruited was women who'd been treated for breast cancer who were experiencing and complaining of brain fog symptoms. But the women recruited had to have an identical twin. So what you have is you have twin A, who is a woman who's been treated for cancer, who is experiencing brain fog. And twin B is that woman's identical twin, same genetic information, same hardware essentially in her noggin. And so she doesn't have cancer, and she's not been treated for cancer, and she's not complaining of brain fog. So what they did was they took functional MRIs, pictures of the brains of both the twin who had cancer, twin A, and the twin who didn't have cancer, twin B, and they put them into a functional MRI machine. And then they had both of them do the same mental calculation task. Okay, so sorry, I have background noise. I'm just pausing for a minute. So twin A is in the fMRI machine, and she's asked to do this short mental calculation task. Twin B, who's never had cancer, is in the MRI machine, and she's asked to do the exact same calculation task. And guess what? Twin A, who has the brain fog, and twin B, who doesn't have the brain fog and hasn't been treated for cancer, on average, they all did the same. They did equally well on the task. But look at the composite picture of what was happening in the brains of twin A and twin B. Let's look at twin B first. So twin B was doing this calculation task that wasn't very difficult, and you can see there's not much lit up in her brain. Her brain's not having to work very hard, right? But if you look at twin A, who's doing the exact same task, look how much of her brain is lit up. She's having to use way more of her brain. There's a lot more blood flowing to areas of this person's brain, twin A's brain, than you can see in twin B. And not only that, the areas are larger and it covers way more of the surface. The bottom line is twin A, the one with brain fog, the one who's been diagnosed with cancer, twin A's brain is working way harder than twin B's brain, right? Now, the subsequent ones are the same. It's the same idea. It's just that the tasks get harder. It's 3 levels of tasks. So the first column is them doing a really easy task, calculation task. The second column is them doing a slightly harder calculation task, same task. Same thing happens. Twin A and twin B, they do equally as well on the task, no significant difference. But once again, if you look at twin B first, you can see that twin B is having to do more work, right, than when they did the first task. So twin B is having to work harder than they did on the first task. But if you look at twin A's brain is still working way harder and using up way more of the brain to accomplish the task. And if we go to the third column, you'll see again, same scenario. Both twin A, the one who's been diagnosed with cancer, and twin B, they're in the fMRI machine. They're given a slightly harder task. It's both of them get the same task to do. Both of them do equally as well. But again, you see that twin B's brain is working harder, more blood flow is evident, but twins A's, look how much activity there is in twin A's brain. The point of this is that the twin that's complaining of brain fog and having difficulty thinking is actually able to perform, right? They're actually able to perform as well as their identical twin who's not had cancer. But their brain has on the good side, on the upside, their brain has learned to do that task by using more of their brain and working harder. The downside is they're having to work way, way harder. So this speaks to the phenomenon that many people who have brain fog experience, which is people around them think they're doing okay. You know, they can go to a function or they can be at work and they look like they're doing okay. They can actually produce what they're supposed to produce, but it takes way more energy. It's very draining and they can't sustain it because their brains have to work a whole lot harder. Their brains adapt to what's happened in their head in terms of their neurochemistry and the interruptions with how they think. They've adapted to it, but it takes a lot more energy and it's complicated. But that's what neuroplasticity allows you to do. But the cost of neuroplasticity is that it takes more energy. And this phenomenon, just as an additional example of this is the same idea. So this is the same idea, but here it's got nothing to do with people who've been diagnosed with cancer. It's simply about people who are younger and people who are older, right? So the younger adults, the fMRI, same dealio. You know, they've both been a group of younger adults and a group of older adults have been asked to do some sort of calculation exercise while their head is in an fMRI machine. So the fMRI machine is taking a picture of the blood flow in their brain, and that tells us how they're accomplishing that task in their brain. So you can see with the younger adults, the areas of the brain that are connected to one another that are doing this task, and you can see how it manages it. But in the older adults doing the same task, it's a very different configuration, right? Different parts of the brain are being brought in to use this task, like more areas of the brain. Younger adults and older adults perform equally as well, but on balance, their brains are working differently because as people get older, their neurochemistry, the way their brains operate, is different. So the maximum capacity approach to cognitive rehab, so this is the approach that we use at Cancer Care, is a very structured approach, and it teaches people strategies for how to improve how your brain moves information around in order to enhance your memory and your thinking in general and how you go about doing tasks. So it's evidence-based. In other words, there is research that underpins how it works, and it mostly has to do with cognitive rehabilitation techniques that were used in other areas other than cancer care. By ecologically valid, that just means it's been used in a variety of types of situations, and these techniques have proven to be helpful. The maximum capacity program that we teach is being taught across the country. It says that it's in BC, which it isn't, I gather, and it doesn't say that it's in Manitoba, but it is. There's lots of people trained across the country in cancer centers like ours doing it. Some areas are offering it by video conference. We've started to do that in Manitoba, and there's lots of people who've gone through this program. And I think that now I pass this over to Ariel.
Absolutely. Thanks, Elizabeth. So my section of the presentation is going to be talking a little bit about this maximum capacity brain fog program. So the specific program that Elizabeth and I and a few others at our center are trained to facilitate. Again, as you can see from the map, it is not offered across Canada, but I don't want that to be discouraging to you. As Elizabeth mentioned at the beginning, there are other resources out there that share some of the same ideas and strategies and techniques surrounding cognitive rehabilitation that are available no matter where you are. And after I finish talking a little bit about our brain fog program, I'm actually going to take you through one of those resources that's free, available online, and we've sent it so that while we can't share our slides, we can send that to you, and it has some very kind of hands-on tips for how to speed up that process of adapting to brain fog. The goals of the program, of the brain fog program that we run, is really to, if you go back to that idea of the superhighway, we're learning to repair and build the pathways in our brain to compensate for kind of the damage that's been caused by brain fog. And we're building a cognitive toolbox. So throughout the sessions, it tends to be an 8-week program. We meet once a week for an hour and a half. We're building up skill sets that are either refinements of things you're already doing or some new strategies to try. And we use a combination of education, so teaching, but also really a huge focus of the program is on self-awareness. So being aware, learning, what are my specific strategies? Where am I having these thinking slips? And when is it most challenging for me? And what is most helpful for me? So again, we're not teaching completely new strategies necessarily. We are teaching some, but we're also encouraging people to work on what's already working. The other kind of piece of this is that there's a very strong focus on what's going to work for an individual. Because the symptoms are so varied, there's not kind of a specific formula of do this, this, and this, and you're going to be fine. So part of this is we teach a lot of different strategies so people can find what works well for them and put them together so they have their own specialized cognitive toolbox. So they have their own kind of set of skills and strategies that help for them. And we put a huge emphasis as Elizabeth mentioned, on the ecological validity, or making sure that you're able to use these strategies in real life. So typically how a session might work is we're teaching some skills, we're practicing them in, the kind of classroom setting, for lack of a better word, or the workshop. And then we're giving activities for the week in between sessions for people to try to integrate these strategies into real life. So there's 3 kind of pieces of the brain fog program. What we've got on an image here is kind of a wheel and labeled with 3 different sections, and each section kind of moves into the other. There's an arrow, and really what that's trying to represent is that none of these components are considered more important than the other, and that they really kind of lead into each other. But we do break the program down into 3 different kind of areas of focus. So we tend to start with memory. And that's because memory is the symptom that people most often report. It's the top kind of symptom or issue with brain fog that people come and have complaints about. So we start with 3 weeks of working on some memory skills and strategies. Then we move on to 2 weeks of working through some task management strategies. And task management is kind of like that ability to organize and break down overwhelming tasks, because that is, again, a very common symptom related to those issues with attention and concentration that Elizabeth mentioned. And finally, we spend 2 weeks working on psychological well-being. And again, it's building on some of the other skills we've set, but there is such a strong correlation, a strong connection between how we're feeling and how we're thinking, that this becomes a very valuable part of the program. And we do see people applying these strategies and saying, wow, I felt so much better. And as a result, my thinking was clearer. I wasn't feeling like I was slipping up as much. I was feeling just more present. So I'll take a little bit of time to break down those strategies or those sections a little bit more. So in the memory skills section, the way we start is by kind of starting to log how our memory is affecting us, what kind of slips are happening, and evaluating what we're doing already, what is working, what is helping. So that's about kind of starting to build some self-awareness, not only about what kind of memory mistakes are we making, but what are we trying to do, or even what could have we done to make things better. So that's one of the very first things we do in the program. And then we spend some weeks learning and practicing a number of different strategies to enhance memory. And these focuses are really on helping us get the information into our brain. Because when we're talking about memory, we can't pull out information that's not in it to begin with. So a lot of these strategies are really about helping us remember and get that information into our brain so it's available later. The difference between external and internal strategies is external strategies are strategies where you're using something outside of your brain to help, like making a list or using a calendar, using your phone for reminders. Sometimes people are resistant to these strategies because they feel like it might make their memory worse. They're worried that it's kind of cheating. The research actually suggests that these are the most powerful strategies to use, that they actually help us get that information into our brain, that encoding piece, even deeper. So absolutely, if you're concerned and resistant to using lists or calendars, I would encourage you to maybe let go of that, because the research doesn't support that it makes memory worse. The research supports that it enhances our ability to remember things. We also spend a couple weeks learning some different internal strategies, so some different ways of using just our memory alone when maybe an external strategy isn't available. We don't have the ability to make a list. So we practice some of these different internal strategies. We do it in the group, and then we give activities to help people integrate those into real life. And really, again, by the end of the 3 weeks here, we're looking at combining strategies. So picking the ones that work best for you and combining them so that you start to feel like you have some strategies to use in different situations. We do encourage people to give them a shot. Sometimes when we teach them, they feel a little bit intangible and people aren't sure if it's going to be, a good one for them. So we do really encourage people to try it out and give it the benefit of the doubt. But eventually you will discover that some work really well for you and some work really well for someone else. I'm sure some of the things that Elizabeth, we go through the program ourselves when we're training. I'm sure some of the ones that Elizabeth found most helpful are not the same ones that I would. So there really is that focus on the individualizing the program. So task management is the second kind of component, and we spend 2 weeks on this. And really the goal of this is that a lot of people report that tasks, things that they used to be able to do fairly easily, something like switching out their winter and their summer clothes, becomes overwhelming due to the brain fog. And even things like going into a room and forgetting what you came in to get, right? Those types of daily activities that used to kind of be second nature. A very common brain fog symptom might be that those are suddenly much harder to do. So the whole purpose of this is to help reduce that feeling of becoming overwhelmed by simplifying these tasks. And we kind of teach a strategy of doing that. There's some different steps to follow. But really the goal is to break it down. And again, we practice in class with or in the workshop with some different kind of scenarios. And then we encourage people to take this into their home life and try it for themselves. Again, awareness is a huge part of this. So trying to stay in the moment with a task. And one of the first things we actually ask people to do is try to stop multitasking for a while, because multitasking seems to be something that doesn't really help brain fog, actually makes it quite worse. So again, that present-minded state and awareness is a theme throughout the program, and it's something we again emphasize in the task management. And really the goal here is that we know concentration and attention are affected by brain fog. So we're trying to find ways of limiting, kind of putting blinders up to some of the distractions, interferences. So you are able to, be working on one thing in your kitchen, move to the living room to get something and successfully, not become distracted by that, or find a way of getting a task like switching your winter and summer clothing out without feeling completely overwhelmed by it. And the final component, we spend 2 weeks on this, is about psychological well-being. And it's really about the fact that we know from research that the way people are feeling is connected to how they're thinking. So we work on helping people try to kind of improve how they're feeling about themselves. And we kind of talk about things like the sense of control and confidence and optimism. So really, a lot of this comes from brain fog can kind of rob your sense of feeling like you have control, much like cancer can. So it can give you a sense of feeling really helpless. And that can kind of, as Elizabeth said, a chicken and an egg situation. But when we feel helpless, we don't tend to feel very good about ourselves. If you start your day, heading out the door, and halfway to wherever you're going, you realize you forgot something, that's going to very quickly create a damper on your day. So we work at kind of combining some of the task management stuff that we've already learned to try to improve our sense of accomplishment and confidence, and again, giving people tasks to do in between sessions allows them to get a taste of what that feels like to accomplish a task and to experience that confidence boost, and to then be able to reflect, how was my thinking when I was feeling so much better about myself? So there's just a little graphic at the bottom there, just pointing out what the research has shown, that we don't know necessarily which comes first, but higher levels of psychological well-being are associated with higher levels of feeling like you're doing cognitively well, that you're thinking well. I know that was a little bit quick, but I did want to make sure that we have time for questions. So this is a slide that we will send out for you. It's not copyrighted. It's just 3 different resources that we find very helpful and are available to you wherever you are. The first is a PDF put out by the Princess Margaret Cancer Center. And I'm going to go through that a little bit in a few moments just to show you what's included there. But it has a lot of actual kind of a lot of tips that are very similar to the type of kind of techniques that we work on in the brain fog program. And then we've just included some other ones that just provide, again, some information and some suggestions of how to work on adapting the brain. So again, as Elizabeth said, the brain adapts naturally. The whole point of working on this is to try to speed up that process and give it some tools, give the brain some tools that we know are effective. So this is the Princess Margaret Cancer-Related Brain Fog brochure. You can search for it online. It's a PDF, and we are going to be sending it out because it's a really handy resource to have. And what it does is it kind of goes through what some of kind of the common symptoms of cancer-related brain fog can look like. So much of what we've talked about today. And then it goes through about some strategies for managing symptoms. So there's a lot of what we've already talked about today, things like using timers and calendars, writing things down. But it gets even more into that. You know, one of them is taking a picture. So if one of your common problems, one that I hear a lot about, is not remembering where you parked, right? You're not in that present-minded state. You've rushed to your appointment, and you don't kind of take time to kind of encode that information of where am I going to work? Where did I park? So things like taking a picture, even taking a mental picture can help actually. And that's one of the strategies we talk about. So organizing your environment in your day. So that's kind of like the avoiding the traffic jams or the construction that Elizabeth talked about is that third aspect of neuroplasticity. You know, they talk about creating regular routines, and then some kind of pieces about sharpening your mental ability as well. So a lot of the, you know, this session isn't a chance for us to teach. There's just not enough time for us to teach these really practical strategies, but this handout gives a great place to start in terms of doing some of those pieces.
Reading this is not kind of just with loads of things, right? Like you can't read a book about how to play tennis, where you got to go out and play tennis and start to learn how to hold a racket and actually do it. And you have to not only do it, you have to do it a gazillion times so that it becomes natural. And just like with learning how to play tennis, the real challenge is making time for doing it and having an awareness that you got to get out there and do it and remember to do it. So reading the book and reading about the strategies is one thing, but doing it is the other. So if you are somebody who's really struggling with brain fog symptoms, I would encourage you to take something like this Princess Margaret booklet and create a plan about how you're going to use it. You know, which techniques, like write it down. I'm going to try and use an organizer. I'm going to start to try and routinely take photos of things I find difficult to remember, like where I parked my car or where I, what is it? Something that I forget where I put it. You can take a picture of where you put it and then you know it. Utilizing routines, always putting certain things that you need regularly in the same place every time. You know, my point is being conscious and deliberate about how you're going to start to utilize this, because this stuff, if you just read it, it's not going to do anything for you. This is why the structured, 8-week program is helpful, because you get introduced to something and then you have like homework, right? You got to do it before the next week. So if you don't have access to a program, you need to consider putting some structure on how you use these materials in order to ensure that you are actually doing it and practicing it over time.
Well, and it's the same principle with the group. You know, someone can attend the 8-week sessions, but if they're not putting the effort in after or in between sessions to integrate this and practice these strategies, they're not going to have the same benefit. And that's really the key to neuroplasticity. It's kind of like if you imagine a field and walking, you know, with tall grass and walking down that field, you do it once. You're not going to necessarily build a path, but you do it enough time, the grass becomes flattened and it becomes kind of second nature. So we practice it so it becomes second nature and we don't have to put as much effort in. You know, that's the idea behind practicing and practicing and practicing. Eventually it becomes easier to do, and it's helped your brain build those new pathways and becomes less tiring as well. Right. So the more natural, or the more we've practiced those, the more kind of we've built those new pathways, the less tiring it is to use them.
So I gather that there was a call put out for people who are interested in this topic to ask some questions. So when I looked at the list that was sent to us, I hope we've addressed a lot of them, but a couple that we don't specifically address in this presentation have to do with how do you get doctors or employers or others in your life to take this seriously. This is a real issue for sure. And I'm just going to give you a disclaimer right off the top is that we don't have an easy fix on it. Okay. So I'm not going to be able to say, oh, here, give them this article and it should, our work here is done. You should have it all taken care of. There are a lot of physicians. There's still a lot of oncologists and certainly loads of family physicians who don't know much about brain fog and don't really know how to direct you. And that's not really an indictment of them or condemnation. As when I was talking about what we know and what we don't know about brain fog, the problem is that there isn't loads of evidence that tells you exactly how it happens, where it comes from and what you do about it. So that's the reason, in the scientific community, evidence is like the gold standard, right? That there's consistent evidence that points to a cause to something, which then points to often to a way to treat it, to ameliorate it. So there's not a lot of medical evidence around it, even though there's loads of evidence that people are suffering these symptoms. There isn't conclusive evidence about what the cause is. And that makes it very difficult for physicians to give you clear direction. And then that filters down to the whole issue of employers, and insurance companies. So I've had multiple clients who, when faced with going back to work, where the main thing their main obstacles have to do with what we would call brain fog symptoms and fatigue, because there's a real connection, right, between the amount of energy, like doing calculations or taking, organizing a task, like it doesn't involve heavy lifting, right? So why are you going to be so fatigued? But if you're if it's taking you more energy, mental energy, and mental energy is real energy, right? That's why the blood flow thing is significant. It actually takes more oxygen for your brain to work harder. So mental fatigue is a real thing. And so often at work, you can manage to do some of the things you're supposed to do, but you get worn out way faster. You can't maintain your focus. You can't maintain your concentration, and you're more easily overwhelmed. So we know that that's a reality for folks, but it's a real difficult thing to get that quantified and nailed down for employers to regard it as a real thing, the same way as if you have, low hemoglobin or, whatever, some spinal problems. It's more difficult. The other piece of what's being, the other question articulate is, how do we get our employees to understand what brain fog is and what it means to our workday? You can talk about it. If you're into a situation where you're actually dealing with an insurance company, I don't have this really well structured, but I'm going to tell you what the experience has been of some of my clients who have dealt with this. So often people are into graduated return to work. And so when they're into graduated return to work situations, they are able to work with, if there's a structure for that in the workplace, they're able to work with their workplace about what they can tolerate and what they can't, and continue to ask for adaptation. If they're involved with an insurance company who's organizing that, if you have the doc, you can get on board, that's great. I've actually had it where people have asked for what kind of literature, or what do we show? So you can ask the people you're working with if they can access some literature. But another compelling argument I've made with an insurance company is to send them the website links from places like you just saw, like the Mayo Clinic, the Canadian Cancer Society, the American Cancer Society, Princess Margaret Hospital, BC Cancer Agency. They have websites. They have pieces of their of their education. They have links like the ones you've got access to now that address this. So it's not like it's not something that the individual has dreamt up. Like, it's out there. We don't have definitive evidence about causation. So like a journal article from the New England Journal of Medicine or Lancet or something, but we definitely have evidence that the major power brokers in the world of cancer treatment are giving credence to this by having websites addressing people's need to try and live with it and improve it and adapt to it. So it's not perfect. Like I say, I don't have a magic bullet. I don't have a bunch of articles to recommend that's going to be conclusive. It's for lots of people in workplaces, it's a struggle. But I've had lots of clients who have also had very good luck because the easiest one, or the places that people tend to have the best results, is working with their workplace as opposed to working with insurance companies. Now, if you're really running up against a brick wall, particularly with insurance companies, another option, remember how I said earlier that measurement is difficult? If you have prolonged difficulties, like say past that 2-year point with brain fog symptoms, something that you can ask and coach your often your family physician to make a request for is neuropsychological testing. So neuropsych testing are done by psychologists with a very specific type of training, and you have to get you need to get if you don't want to pay for it out of pocket, you need to get a physician's referral. Usually in large centers in departments of psychiatry, they have neuropsychologists that do this kind of testing. You can also hire a neuropsychologist, in the community, but you'd have to pay for it, generally speaking. And it's not cheap because it's multiple types of tests that they administer. But that's a late in the going kind of thing, right? That's late in the going, both in terms of time frame. Like, in other words, if you're having brain fog symptoms that are extending beyond the 2 to 3 year mark, you may want to have neuropsych testing to see if there's a specific type of cause or diagnostic category that can be applied to it. But I've also had clients who, within that 2-year time frame, if they're not being believed that there's things that are really impairing their ability to return to their work role as it was before, they've had neuropsych testing that demonstrates that there are certain aspects of their thinking processes that aren't back to normal. But your average bear doesn't usually have to go to that extreme, but I definitely have had clients who have had to do that. So it can be a struggle. It can definitely be a struggle, but it's slowly getting better. But the root problem is the lack of broadly recognized, consistent, and credible evidence to underscore causation.
I would just add, I can't speak for psychosocial clinicians or the social workers and counselors across Canada, but if you are coming up with some of these challenges, it might be worth reaching out to that kind of the equivalent of us in your location to help kind of work through some of this. In case you can't remember everything Elizabeth just said, Elizabeth just walked through some options. Maybe you don't need them now, but you need them when you return to work in 6 months. The counselors or the social workers in your area might be able to be the ones to help walk through some of that piece. really important to emphasize there isn't a magic bullet out there.
Mm-hmm. And thank you both, Ariel and Elizabeth, both for that presentation. There's obviously a lot on structurally, content-wise, as well as some of the practical approaches as well. And I'm sure a lot of folks that are on are absorbing a lot of that information because a lot of it is extremely relevant, whether you're currently going through cancer or you're in survivorship. Can these coping strategies help improve one's neuroplasticity specifically?
Absolutely. That is the entire purpose of them. Is to give us the tools to start. If we're going back to that highway metaphor, it's creating the construction crew to build and repair those pathways.
The maximum capacity program, is that available online or in Ontario specifically?
It is available in Ontario. I can't speak to their online options. Okay. One thing that I do know is, so Heather has a website that lists which cancer centers have trained facilitators. So you could probably check there. Elizabeth, I'm not sure if you have specific knowledge of which centers in Ontario. I do know that Heather has been encouraging people to do this program virtually, especially in COVID. So there's a good chance. We certainly have adapted, but I can't speak specifically for other centers.
So that would be going to, if you Google maximum capacity, that's the name of the company. And if you go to that website, you would be able to find out what centers the brain fog, cancer-related brain fog programs are offered at, because it changes, as you saw by that the provincial diagram, where it's available and where it's not available. I would imagine that just like Manitoba, centers throughout the country have been adapting to go virtual. We've only done it twice so far virtually out of our site, but we'll continue to do it certainly as long as we'll probably continue to do it indefinitely, actually offer it virtually.
Is there any research on whether the additional brain energy required by those who do have brain fog, if it taxes the whole body over time and contributes to like chronic fatigue or any other physical health issues?
I don't think I have a good answer for that. It certainly contributes to people's experience of fatigue. But when you say chronic fatigue, I don't know if that's leading into chronic fatigue syndrome and physical health issues. I'm not aware of that there's research about that. I can only tell you that people's lived experience is that the kind of fatigue people experience because of the adaptations, the thinking adaptations that they have to, the thinking and adaptations that are going on creates fatigue. But whether that translates into, other kinds of physical problems, I'm not aware of research. I couldn't definitively say that or make a causative line between that.
If it's possible to answer research, if there is any on effects of radiation, specifically things like brain tumor and brain fog.
Yes, there is. Okay. There is the kind of brain fog that goes on with whole head, whole brain radiation is well documented.
Through this program, are you seeing any clients that are changing careers after cancer due to any cognitive barriers that they're experiencing? Things like moving out of management into different roles. Any personal experience with that?
I'm not thinking of anyone in specific. Certainly people change careers. Nothing is coming to me in specific about this, but needing an adapted return to work program, absolutely, I have seen.
Yeah, I guess, first of all, I have to say that, working in psychosocial oncology, obviously this, teaching the brain fog program or working with people that are struggling with brain fog those are not our only clients, right? But I am a bit long in the tooth. So I have been working in psychosocial oncology for about 15 years. And I certainly have had people who have changed their careers following their treatment for cancer. And I definitely have had people But I mean, people may change careers for different reasons, not just for brain fog. Their priorities might change, their interests might change, whatever. But about brain fog in particular, I've had people who have definitely decided that they couldn't return to the type of work they were doing following treatment for cancer. But that can be a combination, that they associate with their cancer experience. That can be both related to cognitive things and also to actually physical stamina. So there are some people who have long-term side effects and long-term effects after being treated for cancer that are in addition to their cognition, right? People who just feel like their physical strength is diminished and their stamina is changed. So it's a hard question to answer. I would hazard a guess that there are people who've made that choice and that decision, but I would also, and this is just strictly me, like this is no study. This is like my cohort right here. I would say that most people return to what they do. It might be a struggle to get back there, but yeah, most people would return to what they do from a brain fog perspective. But for sure, there would be people who would make the decision to not after time.
That capacity program, maximum capacity, do you know if it's available through Ottawa Regional Cancer Foundation or anything similar?
I don't know.
Sure.
Yeah, I don't know. But, wherever you are being treated, like, even people who are living far from the cancer center where they're being treated, just call. I mean, they'll have some department in the cancer center that's kind of like, for us, it's something called patient and family support services, but there'll be a version of that in every large cancer center where people are getting diagnosed and where their treatment is being planned. And they'll be able to tell you if they have a similar, if they have that program. I also know, so there's the maximum capacity program that we've talked about in the materials that we've shared, and that's one that's across Canada. But there are also some centers that have programs targeting brain fog that aren't the maximum capacity program. That's by far the largest, the one that's the most frequent one, that's like a structured program that exists. But for instance, I know that at one point there was a program out of, I don't know what the name of the cancer center is in Hamilton, but I knew that there was something that was being done out of Hamilton that wasn't the maximum capacity program. That's years ago, like that's maybe 7 years ago. I have no idea if it still exists. So one way is to look at the maximum capacity website to see where that program exists across Canada. But probably the better way to go is because if you do that, you would miss a program that a place might have developed themselves. So probably a better way to go is to call or email or whatever the appropriate department, or the appropriate department in the cancer center where you were diagnosed and your treatment plan took place. And for those of you who there are people who have been treated for cancer with surgery who never had an affiliation with the cancer center. So, but still, call the cancer center. Even if you weren't treated there, call the cancer center that would be the one that would serve your catchment area.
Thank you all for joining, and hopefully you all learned a little bit about brain fog and some resources available today. Thank you, Ariel and Elizabeth, both. Thank you so much for that session. I know I learned a lot myself, and it was a pleasure having you on. Other than that, everyone, enjoy the rest of your day and stay safe and healthy.